assisting to seated position or dangling. When transferring a client using a 1A, 2A, or sit-to-stand transfer method, remember that residents who can transfer with one of these methods are able to bear some or most of their weight and should be able to move partially on their own. First, assist the resident to move to a seated position on the side of their bed. Use your hands on the person's limbs to direct the movement, and use the lift sheet, similar to when boosting a client up in bed. Due to heart and circulation changes that occur with age, orthostatic hypotension can occur when a person moves suddenly from a lying to sitting position or from a sitting to standing position. Orthostatic hypotension is a sudden drop in blood pressure that can cause clients to feel dizzy and increase their risk for falls with position changes. Orthostatic hypotension is a sudden drop in blood pressure that can cause clients to feel dizzy and increase their risk for falls with position changes. Some clients may experience vertigo, a sensation that the room is spinning. To prevent orthostatic hypotension and these symptoms, tell the person to dangle, i.e., sit up on the edge of the bed, for a few moments before continuing with the transfer. Dangling gives the cardiovascular system time to regulate blood pressure and blood flow to the brain, thus preventing dizziness and falls. Ask the client if they are feeling dizzy before you proceed with transferring. The following are steps to safely assist a client into a seated position. Lock the brakes on the bed. Raise the bed to a working height. Stand facing the head of the bed at a 45-degree angle with your feet apart, with one foot in front of the other. Stand next to the waist of the resident. Ask the resident to turn onto their side, facing you, as they move closer to the edge of the bed. Use the lift sheet to assist the resident if needed. Place one hand behind the resident's shoulders, supporting their neck and vertebrae. Place the other hand around the resident's knees. On the count of 3, instruct the resident to use their elbows to push up against the bed and then grasp the side rail. Support their shoulders as they move to a seated position. Shift your weight from the front foot to the back foot as you assist them to sit. Do not allow the resident to place their arms around your shoulders, because this can cause serious back injuries. As you shift your weight, gently grasp the resident's outer thighs with your other hand and help them slide their feet off the bed to dangle or touch the floor. This step helps the resident sit and move their legs off the bed at the same time. As you perform this action, bend your knees and keep your back straight and neutral. Move the resident as one entire unit, rather than the upper body followed by the lower body. Lower the bed so the resident's feet touch the floor. Observe the resident for symptoms of orthostatic hypotension or vertigo. Ask if they are feeling dizzy before attempting any further movement. Check that the resident is wearing non-skid footwear before transferring. See the image of the steps to safely assist a client to a seated position. If the resident is having difficulty moving during this procedure, use the lift sheet to pull them closer to you or to assist them from a lying to a seated position. The head of the bed can be raised before they turn on their side to support their core strength and to reduce the weight the assistant must bear. During this entire process, do not use the resident's limbs to move them, but rather move them with the trunk of their body to prevent shear and injury to their limbs and skin. After the person is sitting upright and states they are not experiencing dizziness, apply a gait belt for a 1A or 2A transfer. The gait belt should be placed around their waist while considering the location of their breasts and abdominal folds. See the image of applying a gait belt. The fit of the gait belt should be snug, but you should be able to put your fingers underneath the gait belt for support. As the resident stands and their core muscles contract, the gait belt can loosen and tend to slide up, so it is important for it to be snug. If the belt is too long, it can get caught in the patient's legs during transfer, so tuck the excess length back into the belt. Gait belts should not be used for clients with abdominal wounds or some types of heart conditions. A different transfer method should be in the care plan. Contact the nurse if you have concerns about using a gait belt based on the client's condition. Place non-skid footwear on the resident before transferring them from the bed to the chair. These preparations should be done before the wheelchair or sit-to-stand is brought closer to the bed to reduce the risk of injury from the resident inadvertently hitting the lift or chair while moving. The steps to complete a one-person Assist 1A are listed in the transfer from bed to chair, with a gait belt skills checklist found later in this module. If a two-person Assist 2A is required, the same steps are used, but the assistants stand on each side of the resident to provide additional support during the transfer.